Ms Marshall, thank you so much for recognising that the scheme is important and that the integrity of the scheme is important. But I'd be interested to hear from your perspective the importance of the integrity when it comes to the workers and the way that they interact with the scheme and with the clients, because there are providers out there that could be considered a little bit dodgy, and the workers are an integral part of the scheme. Could you please elaborate a little bit, and maybe Mitul and Jo would like to chime in a little?
Yeah.
And yeah.
Oh, sorry, please.
No. That's pretty much it. Yeah.
I'll start off, but as you said, I think it's important to hear from Tony, Jo, and Mitul on this question as well. So, obviously, you know, we support. We know that there's going to be bad actors in this space, and we support the work that's already been done to try and remove the bad actors from that space, including the mandatory registration for the providers. However, we think that in order to keep those bad actors out, we think that a big part of that is, as I said before, the worker registration, which isn't just worker registration, mind you. It is the training, the professional development, the code of conduct, and that scheme of protections around that worker that help them identify the bad actors along the way as well. I might throw to our members to talk about how they see the interaction on the actual floor and how, Mitul, can I start with you?
Yeah, sure. So, look, as a disability support worker, I worked like 19 years with clients, and I have seen the big difference in really professional worker. I think the professionalism and registration promoting will be good for the the clients, service who using our disability services. So in terms of that, when you have a registered worker or registered the professional worker working on the floor, they're providing good quality of care and service, because I have seen it many times happen, because we working not just a client, because they have multiple conditions. So you're not dealing with one thing just disability, because they have behavior, physical needs, the bowel care. Then we got medication, and some of them complex bowel care medication stuff, SPC catheter, and a lot of stuff we day to day, every day we deal with it. So when you have the registered professional worker this recognized, so all the beds, sometimes people sometimes they just replace it with the casual or the agency staff. What happened is they're not a train is supposed to, they're just replacing the people, they're coming in, and what is the problem falls in, the clients are suffering. And some of the time it's I have seen, if it's verbal client, then they can speak out and the thing. But the problem is sometimes many clients I work with, they're non-verbal. They can't raise a voice. So we are the one, the things behalf of them, the raising the concern. But sometimes it doesn't go over. When we raising these things, they talk, these things stays in paper, and you hear it, this time it just goes outside. So if we putting the national level for the NDIS, registration, and basically you require this qualification, this is your part of this minimum requirement. And if, for example, if you have to have a minimum medication stuff, you need whatever the clients needs, put in category wise and have it that registration. So there you be getting the quality service provided, and we make value out of whatever the funding the clients getting, that make value out of money. And it's also we can keep the more people sustainable. At this moment, personally, we burning out. So we having work so many times untrained staff, and the problem is so many clients you work with providing supporting at the same times, and it's not feasible, and we burn out, and also staff get injured, and they have to take off, and they got family to look after. So it's quite often happens. This is the issue with take care of the client as well. And when you have this kind of people working in industries, they're not trained and they have no knowledge of it, they're just coming in feeling easy as they got this shift. But actual reality, they're just main people who are permanent staff there. They are a trained. If they have more proper trained staff, and which is providing good quality of service. and which is like, ongoing, and you're making out, then you can see difference in a client's life. Otherwise, you won't able to see the difference.
Thank you, Mitul. Joe?
Just to add that I'm working in Victoria and we have a very similar, we have a worker registration process that has actually led to really sort of high quality recruitment, but also I work in one of the large providers who are very aware of NDIS compliance and ensuring that, we are all fully trained to the latest requirements and very strict reporting requirements of any issues or incidents. If there is even a suggestion that there's been inappropriate or dodgy conduct, then a staff member is stood down and investigated. So we're all very aware that we have to hold ourselves to the highest standards, and if some people do get through, they are scrutinised thoroughly and removed from the sector. Does that answer the question?
I think so, yeah, thank you, Joe. Can I ask a sub, the measurements that the government is putting into play, will it help? Will they help?
Definitely will help if you put in, the measurement, like, like registration, like the professional registration, like measurement. So it's like, all bed bugs out of this system. Because what happened is, so like people, like, when you make, like, I have like made a complaint for these things, like, when they're reacting badly, when you make, what they're doing, they're removing, they're going out of the organ, they resign and go, but they're going another organization. When you find out somehow they're working the same. So either someone in India, same other people will be suffering because of that sort of thing. So if you have like this kind of registration, like, the measurement and, like we put it in, we protect the people, vulnerable people particularly.
Thanks, Chair.